Welcome to the Real News Network. I'm Paul Jay in Washington. And in Washington, the Supreme Court of the United States is going to decide whether or not President Obama's health care legislation is constitutional. Can government mandate people to buy private insurance? Now joining us to talk about this is Kevin Zeese. Kevin is co-director of It's Our Economy, an organization that advocates for democratizing the economy. He's an attorney who's one of the original organizers of the National Occupation of Washington, D.C. Thanks for joining us, Kevin.
Thank you for having me on.
And you're coming to us from Baltimore, right?
That's right.
Soon to be the new home of the Real News Network.
Congratulations.
So, Kevin, most people on the sort of normally thought of left-right spectrum here, most people on left of center liberal side of things is defending this legislation, and the right, traditional right, is attacking it and hoping the Supreme Court finds the legislation unconstitutional. But you and some other single-payer activists in fact want the Supreme Court to find this legislation unconstitutional. So am I right, and why?
That's right. In fact, It's Our Economy, single-payer action, and 50 doctors filed an amicus brief with the Supreme Court in this case, arguing that the mandate was unconstitutional, that the government cannot force people in the United States to buy a corporate product, and we believe that the reason they're doing it is false. We will not achieve universal coverage. Even the best estimates from during the debate of the health care bill showed that there'll be tens of millions without insurance by 2019. And a recent study last week by the Congressional Budget Office showed that about up to 20 million Americans could lose their employer-based health insurance because of this law. In fact, there's a very easy way to achieve universal coverage, and that's just by deleting two words from the Medicare law, over 65. Because Medicare is a system that provides universal coverage to everybody over the age of 65, as well as people with disabilities. And it does so in a much less expensive way than health care. The administrative costs for Medicare are about 2%. They've been that way for decades. And the cost of insurance overhead and their administrative fees is about 16%.
Okay, let's just back up and get into the legal question a bit that
Sure.
the Supreme Court has to review. The issue here is that to mandate that people have to buy private insurance, various people, your group and also others, including many Republicans and libertarians, are saying is unconstitutional because you can't force someone to buy something. But Medicare is constitutional, and I have to say libertarians agree with that too, that I've talked to, because it's not you have to buy a private product, it's actually a form of taxation that funds the system, and taxation is constitutional. Do I have this argument right?
Exactly. In fact, what Medicare was an amendment to Social Security. Back in 1965, President Johnson signed the Medicare law, and that's all it was. So if Medicare is unconstitutional, Social Security is unconstitutional, and the country has real problems. But I think your analysis is exactly right. I think what you're seeing at the Supreme Court, though, is not left-right. You're seeing partisanship. You're seeing liberal groups that are supporters of the Democratic Party and Obama on one side, and conservative groups that are part of the Republican Party on the other side. What we're putting forward is an empirical, evidence-based approach. And looking at the law, there's never been a time before when people have been forced to buy a corporate product. And looking at the facts, single payer works.
Okay, now within the single payer community, at the time this legislation was passed, there was a division. There were people that were serious activists in support of single payer. And again, I suppose by now everybody knows what single payer means, but I've always thought one of the crummiest terms anyone ever came up with.
It is a terrible term.
So yeah. I think we could start calling it Medicare for all or something like that. Essentially a single government health insurance plan like Medicare.
Right.
There were people that were fighting for that, or even people who were fighting for, what they called a robust public option, who still did in the end support this legislation because they said, well, it's better than nothing because at least you get people with, pre-diagnosed conditions can't be excluded from insurance. It does at least allow younger people up to the age of 26 to be insured. there were some other reforms within that they argued were better than nothing, and get this legislation and then build on that and fight for the single payer. They were saying to jettison this will hurt a lot of families. Why do that when you could support this and then fight for more?
Well, the law includes a severability clause, which in legal jargon means you can separate the insurance mandate to buy insurance away from all the things you listed, which are really basic regulation of an industry. That's all legal. You're allowed to require an industry to cover people with pre-existing illnesses, allow young people to stay on their parents' plan. That's all legal. We're not challenging that. What we're challenging is the mandate forcing people to buy a private, corporate, for-profit product.
But wait a sec. Well, once you challenge that, doesn't that kind of undercut the ability to regulate the other? Because the argument goes, if you don't have this big pool of people all in that same basket, and in other words, you don't have a scale of economics of insurance that would allow you to require insurance companies to do these other things.
Well, the court will look at that question. Most of the courts that have found the mandate to be unconstitutional have left the remainder of the law intact. And so those provisions that you mentioned that people do like would stay intact if that's the way the Supreme Court rules. I think that's the way the Supreme Court should rule. Their job is to look at what's legal under the Constitution and what's not. And there's no question that those kinds of regulations of an industry are legal, but forcing people to buy a product is not constitutional. I think once we get to that point, then the push needs to come for a real, a single insurance provider, a public provider, like a single-payer system as they have in most of the world. Other than the United States, I think every other developed country has a single-payer system.
But are the insurance companies and even the Obama administration going to argue that you can't regulate those things, pre-existing condition, age of being on your parents' insurance, and some of the other things? You can't really enforce that if you don't have the mandate, because it's the mandate that creates the bigger pool. So the two are tied.
You can enforce it. It's not a question of being able to force it. The question is, can the insurance companies afford it? And I think that will then once again highlight the issue. Insurance companies are in this for profit. They're not in it for the well-being of Americans. They don't really provide any health service. They just get in the middle of doctors and patients and make it very hard for doctors to get their billings paid, make it hard for patients to get the treatment they want paid for, and they just get in the way. And what this will show is the reality, that the insurance industry is there for its profit. They can provide coverage to all Americans. All pre-existing conditions. They can provide coverage to youth. The question is, can they profit? And right now, their profits are very high. And so the question of, do they want to keep their big executive salaries, their big advertising campaigns, their big buildings? Are those the priorities, or is it better to provide the kind of health care we need and put their money into providing health care and not into their big buildings and big salaries and big overhead?
So you're hoping that the consequence of the Supreme Court deciding that this isn't constitutional is that it immediately reopens the debate about what is the best system, and in your opinion, that becomes Medicare for all.
There's no question about that. In fact, I think it was a big missed opportunity by President Obama not to put up three systems. The United States currently has three systems. We have the market-based system of insurance, we have the single-payer system of Medicare, and we have the socialist system of the Veterans Administration. And we could have had a great debate about healthcare, which approach works. We have all three in the United States, and there's empirical evidence about all three. Now, actually, if you get down to it, the socialist system is probably the most cost-effective, provides the best coverage. That's what the research shows.
And the reason you're calling it socialist because it's not just government insurance, it's government delivery as well, veteran hospitals.
Exactly. It's more like the British health service. The doctors, the hospitals, and nurses work for the government. So that's a totally government-run, government-funded. Single payer is government-financed, but privately delivered. So you keep the private doctors, private hospitals.
And you have examples of that, not just Medicare, but doesn't San Francisco, the city, have a system something like that?
They do, exactly, and it's based on a restaurant tax. and they're able to provide health care to people who don't have insurance and cover basic services that way. So yes, they do have that. And again, though, it's much easier to do on a national level. We could have one of the greatest healthcare systems in the world. We wouldn't have to be ranked number 37th by the World Health Organization, behind many much poorer countries. We could be number one. We pay enough to be number one. We just don't get that. Right now, the United States spends about 18% of its GDP on health care, while most of the world spends under 10%.
Now, you must be getting a heck of a lot of flack from especially people that are supporting the Democratic Party, the Obama administration, and others. I mean, how are you being received in this argument from some of your colleagues that might be with you on other issues?
Well, that's always the reality. You know, I don't play the partisan game on any issue. That's why I'm part of the occupation of Washington. And we're, by the way, starting a national occupation on March 30th that will go through the whole month. I hope people will be there and participate in that. But I don't play the partisan game. I think we need to move ourselves from partisan politics and do what's best for the country. And I think we need to go with an evidence-based approach, not a libertarian versus socialist, not a kind of philosophical, but what does work? What's the pragmatic solution to the many problems the country faces? I think when we do that, the solutions become evident. And in healthcare, it's evident that the solution is single payer. And by the way, that gives consumers the most choice, because it doesn't tell you have to go to a certain doctor or a certain hospital or can't have a certain treatment. The competition moves from which insurance company you have to which doctor do you like, which hospital you like, which is more convenient, which provides the best services. It really moves toward healthcare as the competition as opposed to insurance as the competition.
Thanks very much for joining us, Kim.
Thank you for having me on.
And thank you for joining us on the Real News Network.